Hi, welcome everybody. As many of you know, I'm Dr. John Stracks. I recognize many of the names that I see here. It's just about 5:30 in Chicago, and so we will give people another minute or two to join in, and then we'll get started. Tonight is a service that my practice in Chicago offers along with Curable as an opportunity for people to ask questions about mind-body medicine that they may not be able to ask in other places for a variety of reasons. And so I will spend the next hour or so here answering as many questions as people want to give me about mind-body medicine. And so if you are at your computer, there should be a chat function at the bottom of your Zoom webinar page. And so that chat function will come directly to me here in Chicago. And I can read those questions and can give my best answer to them. So if you have questions for me, go ahead and start to fill up the chat box with them. I have a couple of questions that came in ahead of time that I will read as well. And in a couple of minutes, we'll get going with those questions. And so, like I said, many of you know me and have either worked with me or seen some of my other podcasts and interviews with Curable. And so for those of you who don't, I am a physician in Chicago. I worked at Northwestern Medicine, it's a major medical center in Chicago for about 7 years, from 2010 to 2017 in their integrative medicine center, and then left to set up my own practice in integrative medicine and mind-body medicine in 2017, about 3 years ago, and did that to increase the access to what I do in the mind-body medicine world. And so I have known about this area of medicine my entire medical career. I had my own health issues back in the 1990s that I worked out this way. Have been interviewed on a Curable podcast about that in the summer of 2017 that you can listen to if you haven't already, and then got to medical school with this knowledge that what happens in our lives can show up in our bodies. And so felt like I could tell people about this and people would get better. And just specifically remember the first time I ever saw a live patient in the hospital who was there with back pain and had been undergoing significant stress at work. And so I talked to her about it, and she was kind of interested, and I told the attending physician what I had found, and he looked at me like I was from Mars and finally told me to go look at the MRI, which was the first time I recognized that it wasn't necessarily going to be as easy as just telling people that, look, the stress can cause real symptoms. What happens in our lives will show up in our bodies, and here's how we can make that better. But I stayed with this area of medicine as much as I could. I worked with a physician in New York City named Dr. John Sarno in the late 2000s, early 2010s, learned what he did and how he worked with patients. I also worked with Dr. Howard Schubiner, who's at Providence Medical Center in the suburbs of Detroit, Michigan, and spent a lot of time with him during my residency training from 2005 until 2009, and then opened up a mind-body medicine practice in Chicago when I moved back here in 2010. And it kind of went along slowly. I'd get a person or two a month who would call because they wanted to talk about this. And by the time I left to set up my own center, I kind of decided that the demand just wasn't there, that mind-body medicine was too hard or too esoteric or too difficult for people to grasp. And so people didn't really want to have that experience or enter into that place in medicine. And as soon as I left the major hospital system and set up my own practice, the percentage of my practice that was mind-body medicine jumped from about 2% of my practice to about 20% of my practice. And it wasn't that people weren't interested in in the concept is that they just couldn't find me in the big hospital system. And big hospital systems aren't that interested, it turns out, in the types of treatments where people can get better a lot on their own and then don't need treatments down the road. And so it was hard for the hospital to support this kind of practice and didn't really expand until I left and set up my own smaller practice. So it was 20% when I first opened up. That jumped to about 33% by the time COVID happened, and now has jumped to about 50% of what I do on any basis, which is great because it's been my passion forever. And I try to offer, in addition to consultations through my office and my own group classes, I consult with Curable, and I'm on their medical advisory board. We sponsor the Hope for Healing series, which is interviews with both patients who've gotten better and practitioners who do this work, along with these occasional question and answers that we try to address where people are getting stuck. So with that, there's some questions that are coming in, and like I said, people had messaged a couple of questions ahead of time. And so let me just start by jumping in and answering some of the questions that I can see here. So the first question is about having a medical background and knowing that overuse of a body part will cause inflammation or scar tissue. And so how do you, when you have a medical background, work on keeping the idea that the symptoms are likely more psychological in nature than physical? And so I think that it can be hard for my patients who are in the medical field to know how to undo some of the information that they've gotten over time. When you train in medicine, obviously there's a ton of attention to physical components of health and very little to psychological or emotional components of health. And so part of getting better in this paradigm is understanding that though all symptoms have a physical component, a psychological component, and an emotional component, the physical component is oftentimes much less of the issue than we would have imagined. And so part of getting better is keeping that in mind and focusing on the psychological and focusing on the emotional. And so when you've been in the medical world and you have this bias towards the physical, you really have to work hard to elevate the other areas. And so one of the ways to do that is to continue to learn as much as you can about the nature of pain and where the various inputs that aren't physical come in. And so that means taking a look at the lecture on my website, for instance, or taking a look at the educational component of Curable, or reading some of the excellent books that are out there of some of my colleagues who I've interviewed on the Hope for Healing series, Dr. Howard Schubiner, Dr. David Clark, Dr. David Schechter, who we're going to be talking to next week, and really sort of becoming familiar with the nature of pain so that you know it's one thing to know it at a head level, but really knowing at a gut level that so much of this experience is about the non-physical aspects of what's happening in our lives. And so even if you come from a medical background, really pushing to understand that that physical component is in the minority is, I think, how I would address that as much as possible. The next question is about avoiding what causes TMS symptoms when there's so much stress at work or home or everywhere else. And so what it feels like if brain chemicals are off and the pain is there almost constantly, how do you stay calm in that situation? And so this, as some of you have heard me talk about over the last several months, this time of COVID is just an incredibly difficult and stressful, time in all of in human history and all of our lives. And so especially in this time, it's important to take the time to do the things that we need to do to work the stress out of our body. And so whether that means meditating regularly or doing relaxation exercises regularly or figuring out some way to connect with other people, even if it's through Zoom or other systems like this, figuring out ways to exercise that work for us in the middle of a pandemic, but some way to really prioritize our ability to take time for ourselves, time to relax, time to let our system shut down for a while. It's even more important now than it's ever been. And so a lot of people, if they've grown up in stressful situations or they live stressful lives, you don't necessarily have go-to strategies for how to decrease the stress. And so figuring out ways to cultivate those strategies, I think, is important. And so again, it's a nice meditation component to the Curable app. There are a number of other apps that are out there that people can tap into. I'm a big fan of the relaxation or stress reduction and relaxation workbook, which has 20 different strategies for how people manage stress. And so flipping through there, trying out some, see if they work for you. If they don't, letting them go, picking up another one, but really devoting, I don't know, 15, 20 minutes a day into a time that's just for you. And you do that for a day or two, and it may not make it much of a difference, but you do it for a week, 2 weeks, or a month, and you really start to see the benefits. And so it's about being regular with your practice of it, and honoring that time for yourself. Many of you have heard me say that since the pandemic started, I have hooked up with 1,000 Petals Yoga Studio in Chapel Hill, North Carolina, which is where my sister lives. But I'm only down there once a year and hadn't taken yoga classes through them previously. But they, in addition to being knowledgeable about mind-body medicine, they were broadcasting their classes as soon as quarantine started, and then have a subscription site where they add a couple of classes each week. And so I have made it a point to get up early and spend an hour 5 days a week on the yoga mat, stretching out, taking care of myself, tending to my mind, tending to my body. And it's made a big difference with my ability to manage through this time period. But it does take that intention of saying, set aside this time that's just for me, and to make it happen. So I think that is my thought when stress is really super high, like it is during this time period. I think it's even more important to set aside at least a few minutes on a regular basis to tend to ourselves. Next question that came in, so talking about asthma. So diagnosed with asthma as a child, symptoms have come and gone, inhalers haven't helped very much, and went to a neurologist, could confirm bad allergies, which triggers asthma, and it tends to get worse when having a cold or a flu. And so the ultimate question is, can breathing issues be TMS? And to that, I would say, absolutely, they can be. They're not always. And so let me take both sides of that. The not always first. Obviously, asthma can be a dangerous disease. And so without having seen somebody, examined them, gotten the full history, I don't want to necessarily take people off medication and put them at any risk. And so you have to know on your own how serious the asthma is. Have you ever been in the emergency room? Have you ever had to have somebody assist you, put a tube down your throat and assist your breathing? Those are those are issues that makes the asthma more dangerous. That's not most people's experience. Most people's experience is that they take inhalers or they don't. They get a little bit worse when they have colds or flus, but that oftentimes it's not particularly part of their day-to-day experience. And so for those people for whom it tends to be more on the mild side, mild persistent or mild intermittent, I think there's definitely a psychological and emotional component to asthma. And so I would start to pay attention to when it does happen, what's going on in your life, is there stress going on? I've definitely seen people where emotional issues can trigger feelings of not being able to breathe. And so we know that there is a mind component to the breathing issues. Another way that I've found that is relevant for people is that when you have asthma, oftentimes it is hard to know, like, are you having trouble breathing? Or are you feeling like you're having trouble breathing? And so there are definitely good ways to get objective evidence about how you're breathing. This is one of the strategies that we've used during COVID, is we've had people get oxygen monitors so that if they're struggling to breathe because they have the disease, we can tell, is part of that anxiety, or do we really need to consider getting them to a hospital? And so for asthma, I do like to, if we're not sure of the diagnosis, to have pulmonary function tests where we measure people's ability to breathe out and how quickly they can do it and how much air they can get out in the first second. And that gives us some nice objective evidence about how bad the asthma is or isn't. And then they also make the peak flow meters, which are little handheld devices that you can blow into. And during an asthma attack, you can get a sense about whether you really are restricted in what you can breathe or whether you're just breathing like normal. And so I do like to, when there's a diagnosis of asthma, get as much objective evidence as I can about what's going on, and then bring that into the mix. Because if, whether you feel like you're having an asthma attack or are having an asthma attack and you're breathing just like you always do, then you can safely assume that there's something going on besides just what's going on a physical level. The opposite being true too. If normally your peak flow is 400 and during an asthma attack it's 110, you know that you need some medication to open up your lungs and make sure that you're breathing safely. So next question. When I wake up during the night and have difficulties falling asleep again, is there anything that I can recommend? And so sleep obviously is oftentimes tricky. And when a lot of people have trouble falling asleep, and a lot of people have trouble staying asleep. So I will say that just off the top, there is a book on sleep called The Effortless Sleep Method, which I have recommended to a number of my patients over time, with a number of my patients finding it significantly helpful. And so there's a lot of good information in there about the nature of sleep, what helps, what doesn't help. One of my favorite recommendations is to change the narrative about sleep to one of what a great sleeper you are. And so we tend to follow our narratives. And so if the narratives that we talk about is about what terrible sleepers we are, how we can never get to sleep, we've never been able to sleep, we've never been a good sleeper, then we tend to follow that. We tend to have trouble. If we can change that narrative around, then we start telling ourselves the story of we're great sleepers. We remember when we weren't, but now we have, we figured this out and we can do it. And even on stressful nights, we can get to sleep and we can stay asleep. And so that's one of the strategies that I really like, is to have this narrative about what great sleepers we are, even if we're not actually, but we tend to follow that narratives and become great sleepers. And so then in the middle of the night, there are a couple just general strategies that I look to. One is that I do think that if you have to go to the bathroom, that getting up to go to the bathroom is helpful. I've had patients who, once they started doing that, they were easily able to fall back asleep. I like to see people, if they're not tired, not be in bed. So you want to associate your bed only with being tired. If you're getting more awake, you want to be out of bed. You don't want to be staying in bed and fighting it as you're getting more awake. And then if you're out of bed, obviously you want to be staying off screens, and you want to be doing something that is likely to make you more sleepy rather than get you riled up. And then lastly, I'd say that really cultivating relaxation strategies can be super helpful for figuring out how to get back to sleep when you're having trouble. My personal favorite relaxation strategy in the middle of the night is literally counting sheep. And so if I wake up, I'm having trouble getting back to sleep, that is my first go-to strategy. I start at 100, I kick them out until I get down, and I rarely get lower than 90 before I fall back asleep. Obviously, that's not everybody's go-to strategy. Some people like meditation. Some people have their favorite yoga poses that they use. Some people do breathing techniques, but picking one or two and then practicing them regularly, practicing them during the day, practicing them at night, in the middle of the night, so that you're confident that you can employ it when you need to bring yourself back to that area of sleep. That book that I mentioned by Sasha Stevens, The Effortless Sleep Method, has, I think, 8 or 10 different relaxation strategies that she's found have been helpful for her clients over time. And so if you pick up that book, I think it's actually in the appendix, but she's got various strategies to try that you can employ. Her strategy is do it for 3 weeks and give it time. Don't do it for a day or two and then throw it out because it doesn't work. Really give it a chance to see if it's something that will bring you more relaxation in the middle of the night so you can drift back off to sleep. Next question says, can you talk about how to reassure ourselves that we're safe when COVID numbers are going up? So much remains unknown about the actual infection rates, and the death rates are high. Is there a genuine risk? So sometimes telling myself that I'm safe right now doesn't feel like enough. I do stay off the news, but COVID impacts daily decisions, go to the store, let my child go to camp, etc. So we've talked some about COVID during these interviews and questions and answers. Some of my current thoughts about COVID: it seems to be accelerating in some states, not in others. I'm in Illinois, where we just entered into stage 4, and the rate, both in terms of infection rate and death rate, has been going down for a while. And so there's not as much of it here as there has been. Doesn't mean that I'm not being vigilant. I have been, we just sent out a newsletter this week advising people to wear masks. I've been very impressed with the data on masks, and very impressed with the ability both to keep it from spreading if we were to have it, and potentially to have some protection if you're around other people. And so I've been stressing mask wearing to people over the last couple of weeks. I also caught a quick glimpse of a report this morning that said that that the risk of catching COVID outside may be as much as 20 times lower than the risk of catching COVID inside. So especially with summer and warm weather, if you're going to be around people, it seems like being around people in an outdoor setting is safer than an indoor setting. And then the other main focus that I've looked at is that, for the most part in my practice and what I've seen, the risk to people who are otherwise healthy is actually fairly low. And so been a number of stories lately about college athletes who've been getting it and transmitting it to each other in their off-season practices. As far as I know, they've all been fine. I haven't heard any stories about them getting very sick. In our practice, nobody's been to the hospital, nobody's been on a ventilator, nobody has passed away. And so if you have access to good healthcare, which admittedly not everybody does, if you have access to good healthcare, I think that that does make a difference for people. And if you're healthy going into it, for the most part, people have been able to move through it fairly effectively and not get super sick. And so I am personally adopting a strategy of I am cautious about who I'm around. I'm wearing a mask in public, but I'm going out in public a little bit. We are allowing our son to play on his baseball team at the moment, and we are sort of gradually starting to see people in controlled circumstances. And so, yes, it can be dangerous, especially for people who have underlying health conditions, but for a vast majority of people who are otherwise healthy, even if people are to get it, I think a very, 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 very high percentage of the time, people will move through it okay and be all right. We're also, as far as having gotten it and potential to get it again, the data's still out on that. And so we're still trying to learn about how much having had it previously conveys an immunity moving forward. I don't think we have the answer yet. And so even my patients who've had it, I'm encouraging to be cautious, but not to completely isolate. I feel like I've seen my patients who are living by themselves really start to miss being around other people. And so I think choosing your spaces, wearing masks when able, distancing more than 6 feet, I think it is safe in most states at this point to start to do a little bit more of this than we've been doing previously. So next question. When pain appears, what are the steps to take from a TMS practice? And so one of the things that I've been doing over the past month or so with some of my extra COVID generated time that I don't have commute time anymore, less activities going on. So I've got extra time to think about mind-body medicine and what makes it work well. And so one of the handouts that I've been putting together literally just in the last few days is about what to do when you get a relapse. And so here are some of the ideas that I've been thinking about when pain comes back. And so one, when we learn about mind-body medicine and we learn about what this means, it doesn't mean that we're never going to have pain again. And so expect pain and symptoms to show up at least somewhat. What we're looking for is when the pain and the symptoms are present, that we don't panic. We know where they're coming from. We know that we have the tools to calm them back down. We know that it's not a disaster. And so knowing that that's likely to happen, I think, is an important part of managing the pain when it pops up. Knowing that pain will show up from time to time means that you don't have to feel like you're back at square one when something happens. And so you can remind yourself, like you've known about this, you've had some success with getting symptoms to go away. And so when something pops back up, it's not the end of the world, and it doesn't mean you failed. I was talking to somebody earlier about this morning. It's not a failure when something happens. It's just your body speaking to you and letting you know that something's going on. And so other thoughts I have, putting a plan in ahead of time. What are you going to tell yourself when you relapse? What's worked for you before? Jotting down notes about things that are helpful for you and then putting it in a place where you can find it and go back to it when the pain pops up. In addition, those of you who are using Curable, there's the emergency button that you can push where they have their ideas what to do when the pain is there. And so that's another strategy and another tool that's available. When the pain pops back up, plan beforehand how to get back to movement and expose yourself to movement again once the symptoms start to get under better control. And so that's about probably gradually moving back into your activities while giving yourself the message that you're safe. That's some of the somatic tracking that my colleague Alan Gordon has been doing with the Pain Psychology Center in Los Angeles. He had a great Like Mind, Like Body podcast talking about that just a week or two ago that you should listen to if you haven't. Other things to do when the pain appears, asking your body what it's trying to tell you. So oftentimes, remember, our body's not the enemy. Our body's trying to work with us. And so trying to get some information from our body about what our body is trying to convey to us is important. That could mean that there's an emotion underneath the symptom that we need to tap into and identify, whether it's anger or sadness or fear or shame, or sometimes even happiness. And so looking for those hidden emotions or something else that's just outside of our line of sight. And so is there something going on in our lives that's not obvious to us, but if we can identify, will help explain why the pain is there in our bodies. A question that I like, this is one of the questions that helped launch Curable a whole number of years ago. Frequently we'll ask people, what happened in your life yesterday? What's going on today? What's going to happen tomorrow? And so an example that I give regularly, some of you may have heard me talk about this, but a number of years ago, I was getting ready for work in the morning. So I was standing at my sink and I was shaving. And shaving, for those of you who don't do it very often, not a hugely dangerous activity. And yet there I was shaving one moment and on the floor with a back spasm in the next moment. And I've been doing this work long enough to know that I was probably okay. So I pulled myself up on the sink and I looked at myself in the mirror and I said, what was I just thinking about? And when asking that question, it occurred to me that I had just been thinking about a difficult conversation that I was going to be having with my boss that day that I didn't really want to have. And it was an uncomfortable enough thought that my body had a back spasm to take that thought right out of my head. And so, like I said, I had been doing it long enough to know that something like that, what was going on, but I still had to breathe, calm myself down, remind myself that I didn't really injure myself shaving, and then ask the question, what was happening yesterday? What's happening today? What's going on in my life tomorrow? A couple other last thoughts about this. I said that Alan Gordon's got a nice new podcast, and then Like Mind, Like Body, which is Curable's regular podcast. They had an episode with Christy Weepy, who's another colleague from the Pain Psychology Center, now living in Las Vegas, and she talked about how she's so much better than she ever was, having learned about mind-body medicine, but that she still has pain and still gets flare-ups. And the way she termed it was that she tries to remember that her body will stick up for her when she needs it to, when she's not getting enough relaxation, when she's not getting enough sleep, when she's getting too much stress in her life, when there's an emotion she needs to identify. And so I really liked that language. Her body sticks up for her when it needs to say something. And so remembering that the pain is not the enemy, the pain is just pointing the direction to the problem. And then lastly, as the pain comes and goes, getting a sense of what causes relapses for you and what you have done in the past that's helped you climb back out of that. And so starting to track that so that if the pain does pop up, you know that you can reliably find it with these couple of questions to yourself or these couple of activities. I was a very high level golfer over the course of my youth and college career. I don't play nearly as much anymore. And so I kind of have a little bit of a love-hate relationship with the game at this point. But if I throw my back out, and I do throw my back out occasionally, I can reliably make it better by playing golf. And so think about that for a second. I can reliably make my back better by playing golf. That's not true for everybody, but it's something that I'm good at, that I'm comfortable with, and that gets me out of my head and into my body so that I can get back there and make those physical movements and not be scared of it. And so it's one of the strategies that I turn to. It won't be everybody's strategies, but one of the strategies that I turn to when I need to. So next question. I was diagnosed with a benign brain tumor last year, set off a cascade of pain and chronic daily migraine, even though it doesn't look like the tumor is in a place that would cause the pain. So it's gotten better, but it's there almost daily, living with a tumor that may eventually need to come out or shorten life expectancy. How do I get past the fear and find inner safety when there's something so terrifying? So first of all, I'm sorry about that experience. A tumor is not the kind of diagnosis that anybody wants to have happen, clearly. I'm glad that it's benign, obviously. And so I have a number of my patients who have benign tumors who live with them indefinitely and never cause them any issues. And so a couple of thoughts on managing fear. So one is trying to make sure that you are clear in your own mind of the facts that are going on. How dangerous is this tumor? How likely is it to need to come out or cause a shortening of your life expectancy? Because a lot of the benign brain tumors that I know of don't do any of those. They don't necessarily need to come out. They don't necessarily cause problems. They don't necessarily cause symptoms. And they don't necessarily put anybody at a health risk. And so trying as much as you can to answer that question, and it may take some research and there may be conflicting reports, but if there's a, say, 99.9% chance that you'll be fine, sort of thinking about that, like 999 times out of 1,000, everything will be fine. And so it doesn't mean that there's zero risk, but the risk may be lower. And if you don't do that work, you may feel like there's a 50% risk that's need to come out. So really checking with the statistics as much as you can, what's the likelihood that this is going to cause you issues? Other strategies that I would use include what we were talking about earlier, spending some time on a daily basis just with yourself and your spirit and your relaxation. And so trying to help your nervous system calm down on a regular basis as much as you possibly can, and figuring out which strategies work well for you. Is it meditation? Is it yoga? Is it relaxation? Is it talking to somebody? Is it going to therapy? Is it exercise, gentle exercise, intense exercise? And so cultivating that on a daily basis, because if you're living with that kind of diagnosis, having time just for you to be with you and to calm yourself down is important. And then, you know, the only way through fear is through the fear. And so not pushing the fear away, not telling yourself that you're being ridiculous because you have this diagnosis. So allowing the fear to be present and not trying to fight it, but also not necessarily reacting to it too. And so not letting your thoughts get out ahead of you, not, like I said earlier, assuming that something bad is going to happen, not assuming that when you feel a symptom, it's because something is growing with that tumor. And so, so allowing the fear to be present, but trying not to let yourself react to it on a regular basis. And then trying to get a sense of what kind of negative thoughts are going through your mind when the fear is present. And so I talked to at least one of my patients who's here about this recently, that I've been investigating the work of Dr. David Burns, who's a cognitive therapist in Northern California, Palo Alto area. And I'm fascinated with his strategies for helping negative thoughts to calm down. And so the first step is really understanding what's going through our mind on a regular basis when this is going on. Because if we don't know that, we don't recognize it, then it's hard to battle. And then once we have those thoughts, it's getting worse, it's going to kill me, I need another MRI, whatever it is, trying to see if we can put more positive thoughts in its place. And so what can we do to put more comforting thoughts in our brain. And then 3, what do we need to do to believe those thoughts? Because a lot of times when we think, if those of you who are familiar with cognitive therapy, we think, oh, if we just replace the negative thoughts with positive thoughts, we'll be fine. But if it was simple as that, then it would be easy. And so it's about figuring out strategies for how to talk back to those thoughts, how to recognize why they're not necessarily true, and how to replace more comforting, calmer thoughts in our brain. One strategy that I've been using lately with my patients is to talk it out loud. And so I'll play that part of their brain that says, you're in trouble, this is going to be like something bad's going to happen, this is going to end badly. And they'll work on what does it take to replace that with something more positive and more useful. And if they have trouble, we'll switch it around. I'll play them and say, this is how I would answer that challenge that I'm getting from your brain. And then we'll turn it back around and give them another shot at it too, until they feel like they really do have some strategies for rebuffing those negative thoughts. And there are times where that can make a huge difference in our ability not to believe those negative messages that are coming into our brain. Next question. When I began expressive writing and incorporating breathing meditation, pain seemed to oscillate in intensity, and so migrate in different parts of the body, feels active, and then reduces when resting. And so is that to be expected, and how long will it continue? And so, so I do say frequently that I think that when the pain starts to move around the body and change shape and format, that's a great sign. I really honestly think that that's a sign that we've got the pain on the run and it is in the process of moving out. And so if you're able to move the pain around the body, I find that a hugely helpful and positive sign in the struggle. I think that as you do this work, it's not unusual for the pain intensity to rise at the beginning. Expressive writing and emotional expression can really bring up a lot of old memories. It can bring up a lot of unsafe thoughts and unsafe memories. And so it will, I think, change in intensity and get bigger and more scary for a while. And so part of the strategy is to keep ourselves calm, to know that we're not in danger. Any messages that you can give yourself about the pain is not coming from your body. The flare-ups in pain based on what we're doing psychologically don't have anything to do with a physical issue. And it's important to notice when we get the pain to go down using these strategies, it's also important to notice that the pain goes up for non-physical reasons, because that helps us cement this idea in our minds that we're not just dealing with a physical issue. And so it obviously lasts for different lengths of time and different people. And so it's hard to say a couple of days, couple of weeks, probably not a couple of months would be my thought. And so the strategy is to, like I was just saying, that through the fear is through the fear. And so reminding yourself everything you know about the nature of mind-body medicine, you're not putting yourself at danger, you're not making any kind of structural issue worse by doing this work, you're pushing into places that the pain has been protecting you from over time, whether it's memories or emotions or thoughts. And so as those surface, our brain will say, no, the strategy's been working, it's been working. And it will try to raise the intensity on the pain. And so reminding yourself what that's about, pushing through, not working on it too long each day. And so limiting the time that you're working on it, but continuing to work through it. And oftentimes it will start to calm down and seem more manageable. The next question is about how to handle defense mechanisms. So numbness, shield, detachment. And so, as I was just saying, defense mechanisms are there to protect us. They are there for a very important reason. And so one, I think honoring the defense mechanisms is a really good place to start. Like, these are not there to make our lives miserable, these are there because at one point in our life, it was incredibly important that that defense mechanism was in place. And numbness and detachment, they're very, very good ways that children learn to manage uncomfortable situations. And so trying not to get down on yourself for having those defense mechanisms, those were important. And hopefully you're in a different situation now, and so you can work on using other strategies, but those mechanisms came about because they were needed at one point in your life. And so from there, oftentimes what I'll recommend is making the benefits and the costs of the defense mechanism explicit. And so like literally putting down on paper, these are the reasons that, say, the numbness is present or would be present. And these are the reasons that I would want it to go away. And so doing that does a couple of things. And so one, it helps you when you see all these great reasons for the defense mechanism to be there, it helps to explain why it's so stubborn and why it won't go away easily. It's done a lot of good and is probably still doing a lot of good for you. And so that's why it's sticking around. And oftentimes, I was talking to somebody this morning where we thought of so many more reasons for the defense mechanism to be there than to not, that she wasn't even clear that she necessarily wanted it to go away. But once you've done that, once you've listed out every potential reason that it would be there and every potential reason you'd want it to calm down, then kind of judging each side. If you total to 100, what percent is on each side? Is it 50-50? Is it 90-10? Is it 99-1? And making sure that the benefits of getting the defense mechanism to go away are more than having the defense mechanism stay. Because if it's 90% that it's beneficial to stay and only 10% that you want it to go away, it may not be ready to go away. And so it's good to know that. And you try to give yourself the space and the kindness to say, like, I still need this here until I learn other strategies to deal with whatever it is that it's protecting you from. If it feels like it's worthwhile to get the defense mechanism to go away, then you recognize, okay, these are everything that it's been doing for me. It helps protect me from emotions. It helps protect me from mean people. It helps to protect me from super intense situations. It helps protect me in social situations. Then you can start working on what else do you need to put in place so that you can manage those situations. And as you put those strategies in place, you should be able to find that you need the defenses less as you move forward, but really trying to make explicit, why is it there? What's it protecting you from? And making sure that you're cultivating other ways to manage those things that are being thrown at you. Next question is about autoimmune disease, rheumatoid arthritis in particular, pain levels and functioning. And so what I normally say about autoimmune disease is that there are many reasons that people get autoimmune disease, stress being one of them. And so if somebody comes into my office to talk about rheumatoid arthritis, I don't start with a mind-body approach, even though it's on the list of what I'm doing. And so I'm talking with people about the food that they're eating, their hormonal function, the stress in their lives, potential infections, exposure to toxins, anything else that's specific to that person. And we're working around all those areas to try to calm down the immune attack, in this case on the joints, but in autoimmune disease, it can be immune attack anywhere in the body. And so for the stress component in particular, all pain has physical component, psychological component, and an emotional component. And we work in all those areas. And so if it's a 50-50, if you work on the psychological emotional side and you can pull the pain and symptoms down 50%, then that's fantastic. If you can do that 50%, you may find that there's more to go. Maybe it's 70% or 90%. And so there's always a stress and an emotional component to it. And so for my patients with autoimmune disease, I definitely recommend that they do this kind of work as part of how they're trying to holistically treat the disease. I also always point out to people with autoimmune disease the connection between autoimmune disease and trauma. And so my colleague Donna Jackson Nakazawa wrote a fantastic book about many aspects of this called The Last Best Cure that I frequently will refer people to. And that's a nice description of both what she did to calm down her autoimmune disease that didn't have to do with physical interventions, and the state of the science on trauma and how it affects our immune system. The other book that I really like is called The Body Keeps the Score by Dr. Bessel van der Kolk, which is his life's work about trauma, how it makes its way into our body with specific attention to what it does with the immune system. And so even though it's not the only way that I would treat rheumatoid arthritis, I do have a significant mind-body component to any patient I'm working with who has an autoimmune disease. I also sometimes will have them spend time each day literally visualizing their immune system calming down. And so I think we have more connection to our immune system in that way than we would recognize. And so spending, if you do any meditation, spending some of that time each day, just visualizing the immune system, getting the stand down message and saying it's okay to relax, it's okay not to attack our body. Next question. Podiatrist told me to get foot surgery. Had pain in my foot for more than a year. I'm going to get a second opinion. Knowing that the pain can be mind-body, how can I make sure this is really needed and not mind-body chronic pain that I can address with mind-body methods? And so I definitely have had patients with foot pain. I'm working to get one of those patients as a guest with me on a Hope for Healing video cast sometime this year. I have found that with foot pain, sometimes it takes a little bit longer to go away than, say, back pain does, or joint pain sometime. And whether that's just because of the nature of what it is, or it's literally those nerves are so long going from the brain all the way down to the feet, that sometimes it really does just take a while and a fair amount of time and effort to get it to calm down. As you know, surgeons see the world through a lens of surgery. And so when you go to surgeons, oftentimes they're going to say, this is the way to make it better. And I've definitely had patients who have had foot surgery and then sort of decided that maybe that wasn't the issue for them and weren't so thrilled that they had gotten the surgery. And so I usually advise people not to rush into any surgeries. I've had patients who have had 3 and 4 and 5 different opinions from surgeons. I had one patient with back pain who had 4 opinions from 4 different surgeons who all said she needed an operation. And the 4th time she went to a surgeon, the surgeon said, look, like, you can't get 4 physicians to agree about anything. You've got 4 physicians telling you to have surgery. What are you doing? And she came to me and she worked on mind-body medicine and she's been fine. And it was before I left the hospital. So that was 4 or 5 years ago. And so just because the surgeons are saying, yes, I see this as a surgical intervention, doesn't mean that it absolutely has to be a surgical intervention. And so I would work hard on as many different mind-body medicine strategies that you can. And I'm working on identifying sort of all the various areas that I can that people develop pain, whether it's not understanding mind-body medicine, whether it's not letting emotions come out when emotions are present, or not drawing good boundaries, or not being kind enough to ourselves. But there are a variety of reasons that pain can set in. So trying to work hard in all of those areas, and I would do as much work as you can in those areas before deciding that surgery, would only do surgery as an absolutely last resort. And I don't necessarily know that I always trust the surgeons to say, oh yes, like they're accurate in their assessment of this being a surgical condition. Because as I said, I've had patients who have been told to have surgery and end up being just fine without it. Next question is about Parkinson's. I have pain in my hip. I don't know if it's TMS or Parkinson's. There's no structural problem. Maybe it's bursitis, no accident. And so when you have a disease, Parkinson's, rheumatoid arthritis, you don't always know which one is which. And so like I was saying about the rheumatoid arthritis, you move forward as if it's a mind-body medicine issue, and you apply all the strategies that you can come up with, whether it's using Curable or talking to me or another mind-body medicine practitioner or reading books about it. But being clear that you've identified anything that could be going on in a mind-body medicine arena, and working hard to try to heal what you've identified. And so I would make that assumption first off, and I would work in that area. If you can't figure anything out, then you can assume maybe it's the Parkinson's, although Parkinson's doesn't always cause pain in people. And then the issue with Parkinson's, obviously, is it's hard to treat. And so I would move forward as much as you can in the mind-body medicine arena and assume that even if there's a Parkinson's component, the Parkinson's component is a small amount. And so you're very likely to make a lot of headway using these kinds of methods. And you don't necessarily have to know which it is, because there's probably components of both, but doing everything you can on the psychological, emotional side, and you may find that you get a lot more benefit from treating it that way than you would otherwise. Let's see. Next one, so a couple more questions here. Any recommendations for when the pain lasts for a few months? And so it's definitely hard to manage when the pain just continues, even though you are working on it and working on it and working on it. And so remaining calm, obviously, being clear in your mind that you think it's a mind-body medicine issue, and know in your mind where it's coming from so that you can calm down those danger signals. And then continue to apply the strategies that you know of. When the pain's really not going away, a couple of things I think about. Sometimes we talk about, is knowing where pain is coming from enough to make it better? So is education about pain enough to make the pain go away? And the answer is sometimes yes, and sometimes it's not. So if it's not going away, I do look for people to find, is there something that you need to do? Is there a challenging situation that needs to be addressed? And so that's something that I frequently will suggest people look at if the pain doesn't seem to be budging. Similarly, strong emotions can be underneath the surface. I had a patient who called me. She had seen Dr. Sarno, my colleague in New York, for a consultation 20 years ago and had been good for 20 years. And she had this flare-up that she couldn't go away. And so she called me and we talked through it. She was living in New York. This was actually in early March. And I was like, well, of course, like COVID, how could you not have a flare-up? She's like, no, I don't think it's what it was. And it turns out her dog was sick. And the dog ultimately died. And she messaged me afterwards and said she had to put her dog down so hard. And so the moment that happened, the pain, she said she broke down emotionally and the pain disappeared completely. And so she completely turned it from a physical sensation into an emotional sensation, but a hard emotional sensation, and one that she couldn't get to until her dog literally had to be put down. And so looking to see, is there a strong emotion somewhere underneath the surface? That's one place that the pain will get stuck for a while. Another that I think about is sometimes no matter how hard we work on this, we can't get the pain to go away just by ourselves. And so I've got 2 podcasts that I did with Laura on the Curable Like Mind, Like Body podcast. The first was about how I learned about this 25 years ago, where I more or less got the pain to go away on its own. The second was a big flare up that I had when I opened my practice 3 years ago, and then I couldn't get to go away on my own. And so I reached out to a variety of colleagues and practitioners who helped me in a variety of ways until I was really able to get a better handle on it. And so sometimes we just need to bring other people into the mix and help us figure out what we need to do to move forward. And then the last that I touched on earlier is that sometimes the symptoms are doing a really important job for us. They're protecting us from a feeling or a situation or something that's dangerous. And so trying to be as explicit as you can, where are the benefits of having the symptoms? What's it doing for you? What's it doing there in your body? And really working hard to look on the benefits of the pain and the symptoms being present. And then as you list them all out, sort of looking at it and saying, given all that, given how helpful these symptoms are being, is it the right decision to work on getting the symptom to go away? Or are the benefits so strong that now just isn't the right time? And so making that as explicit as possible sometimes will give us direction as to what we need to do. And so those are some of my thoughts about what to do when the pain is sticking around. Last question: diagnosed through x-ray and ultrasound with severe osteoarthritis in the hip, bone spurs, the other hip. I was told I need a new hip, but I prefer my old hip. And after a few months of pain, the pain went away. Is there anything that could be done for arthritis that complements the mind-body medicine work? And so obviously a lot of the work that I do is in the mind-body medicine realm. And so I'm usually talking about how to think of pain and symptoms psychologically and emotionally. This question is about the integrative medicine strategies that I use. What else can we pull in to help with what's osteoarthritis, which I oftentimes think as changes on x-rays and ultrasounds, but not necessarily a cause of pain. That's what the studies have shown over time, that it's very hard for us to look at imaging studies and know who's got pain and who doesn't have pain. But I do counsel people frequently on diet. I do think it makes a difference. I think some people can get inflammation in their body when they eat grains like gluten or sugary foods, or sometimes others like dairy or soy. And so I frequently will work with people on a food or two to pull out of their diet to see if that makes a big difference for them. I also frequently get the question from people who have been diagnosed with 40 food allergies or 400 food allergies. And when people come to me like that, oftentimes I do think that's a mind-body medicine issue. And so I'm working to actually bring foods back into their diet as opposed to keeping them away. But I do think that foods that can create inflammation, sugar and grains being two of the biggest, alcohol sometimes being another, that pulling those foods out of our system for a while and then maybe bringing them back in gives us a nice controlled experiment about how our body responds to these variety of interventions. If people aren't noticing any difference, then I have them continue to eat those foods. If people feel like it really does make a difference for them, then I'm perfectly comfortable with people having some dietary changes as long as those dietary changes are not too extreme. So, so with that ends all the questions for this evening. And so we'll sign off in just a moment, but thank you to everybody who has been here and asked these insightful questions and has spent your time with me this evening. We have recorded this, and so we'll try to get it up on our website sometime before the end of the week. And so if you want to watch it again or recommend it to anybody else, feel free. Remember that during this time of COVID, I am more available than normal to provide consultations for people who who don't live in Illinois. And so if you are interested in touching base with me individually about your situation, please reach out to our office and let us know. We have a number of Hope for Healing series videocasts that will be upcoming, 2 in July, one with Dr. David Schechter, the author of Think Away Your Pain and a board member for Curable. He'll be talking with me about his 30 years of experience in this field. And then the end of July, I'll be talking with Dr. Dan Ratner, who is a psychotherapist who does a lot of this work. And then in August, looking to get one of my patients with migraine headaches on, and then hopefully another psychotherapist at the end of August, beginning of September. So a lot of events coming up for us over the next couple of months. The next question and answer series, I believe, will be or at the beginning of July. And so I think it will be right around Labor Day holiday, give or take. So look for more information from my office and from Curable about all these events. So with that, I will sign off for the evening. Nice to see everybody here on Zoom. I hope everybody continues to stay safe, have a good rest of your summer, and I hope everybody has a fantastic holiday weekend as well. So good night, everybody, and have a great evening.